Hey, hi, this is Carissa Williams and the nasogastric feeding tube video for Fundamentals Lab. So first you want to make sure you have all of your supplies out. This is going to be my lovely patient today. Obviously they don't have an abdomen, but I will explain what we're going to do with that. So first thing that you want to do is you want to make sure that you review your patient history if they have any nosebleeds or if they have any history of aspiration or polyps in their nose, if they're taking any anticoagulants, if they have chronic sinus infections or any facial surgeries. And then you're going to do your standard ADET. You're going to introduce yourself to the patient. Hi, my name is Carissa. I'm going to be your nurse today or your student nurse. And we're going to be performing a nasogastric tube insertion on you today. You would make sure that you're checking their name and their date of birth. You'd be double checking the provider's orders to make sure this is the right patient that needs the nasogastric tube. You don't want to be putting a tube down anybody's nose that doesn't need it. Provide privacy and make sure your supplies are on a clean surface. My supplies are on a clean surface. And you perform hand hygiene. We're going to pretend that I'm doing that. Next, you would, like I said, inform them of what's going on. So I'm going to be inserting a nasogastric tube because you need medicine that's put in, in your stomach, or you have a blockage that needs to be taken out, or you just need some nutrients put in. Whatever their issue is, verify that that's what it's being for, and that's why we're doing this. Make sure that you're asking them, hey, Miss Williams, are you okay with me are you okay with us doing this procedure? You make sure you have consent. Make sure if you are going to be removing it, make sure you have consent to remove it, and make sure you're telling them why you're removing it. And make sure you tell them that there is some discomfort with a tube going down their nose, down their throat, into their stomach. And also as it's being removed. Okay. You would assess the patient for if they have any pain, nausea, or vomiting. You would make sure that they are in a high Fowler's position. That's 45 degrees. You would raise the bed to the level of your hips so that it's more comfortable for you to be doing it. You don't want to be stretching over and leaning over and hurting your back while you're doing this. And you would perform hand hygiene again. You would be placing your tape. My tape is at the edge here. You can't see it, but it's all right here at the edge of this. And one would be cut midline, halfway through, and make sure it's like that. You would open the NG2 packet. This is partial to the video, little side note, some of our lab bags of other students in my class and my own did not come with a sump NG tube in it. Other people's did, but some people's did not. I don't know what that is, why there's like that, so today we're using this. You would make sure that there's lubricant. There's my 2-year-old background, you see right there. You would make sure that you are putting lube on the first couple inches of the tube. You would put on sterile gloves. I only have one glove, so we're just gonna work with this one glove. One that fits me. The other gloves that come in the package don't fit. You would assess the nasal passage with a pen light. We're going to pretend this straw is my pen light because my son displaced mine. So you would make sure there's no polyps and it doesn't look like any blockage, no septal deviations, and make sure that it's all good. You would check their patency. So you would hold one side of their nose or have them hold one side of their nose and breathe in. You do the other side, breathe in with that whole nose like that, and you would make sure that it's patent. You could take a tongue depressor to the back of their mouth, and you could touch the back of their throat to assess their gag reflex so that you know it's working, because it should be working while you're going to put this down their nose. You would auscultate for lung and bowel sounds. So you got your stethoscope, make sure everything sounds good and how it should be before you start putting this tube in. You would continue to be talking your patient through all the steps, make sure that they are informed what you're doing. It makes people more comfortable. Next, we're going to measure the tube. I can't obviously measure this on my patient here, because they don't have a xiphoid process. So I would measure this on myself. It is from the tip of your nose to your ear. And the sump tubes have numbers on them. So it'd be tip of the nose to your ear. So we know where that is. And then down to the end of your xiphoid process. It's about there. And you could take a piece of tape and you could wrap it around there, sticking to my glove, so you know exactly how far you need to be going in. So you don't need it any further than that, because then it could be going into the small intestines, and that's not where it's supposed to be. Okay, so next you lubricate this first 4 inches. You place a towel across their chest, their non-existent chest right now. You would place it across their chest just in case they start spitting up or anything like that, or or they end up throwing up. That's also why you have an emesis basin. If they do decide to throw up, you can catch it before it falls on themselves. You need to make sure that you have a cup with a straw, because as you're going to be inserting, they're going to be drinking, so that you can push back the tube. So, and this is all within my reach, like I should be. So, we're now going to insert the tube into their nostril. I'm choosing to use their right nostril here. And we loop this up, so this is all good. And we're going to go back towards their ear, is how you want to do it. You're kind of going like back, and then when you start feeling resistance, that's where it's going to have to start going down. So that is where you will have the patient take a sip, and as they swallow, advance the tube further. That's helping them they're kind of like swallowing the tube as they're swallowing the water. They're helping you do that. So you'd have them keep taking a sip as they're taking it down. So we're pretending that they're still sipping. You can see my things coming out the back there. Obviously, it'd be going down the back of their throat, and you'd have them open their mouth. You would check with a pen light, make sure that you see it's going back down the back of their throat. And it is how it should be. So I need to go to my piece of tape. You can see my thing coming out there. My piece of tape reaches the ear. That's where it should be. So, right? I guess I don't know. Maybe not. Okay. So you have that all measured out, and then you instruct the patient. No. Okay, so you want to secure this with a piece of tape, sticking to my gloves. You would secure this with a piece of tape to their nose. Oh, it's really bad. It's sticking to my gloves. You'd secure that to their nose, and then you would secure it to, and then you would secure it to their nose, and then you want to auscultate the lung sounds again, because you want to make sure it's not in the lungs, because it should not be there. You would withdraw a sample out of the little air tube that's in there. A regular sump tube has one in there. You would take it out of that, and you want to test the pH of what you withdraw from the tube. It should be from a 0 to a 4. That would be the acid of what a stomach should be. If it's 6 or more, then that's probably in the small intestines or in the lungs, which is where it should not be. And you'd also do an X-ray to make sure that the location is where it should be. You would tell them that, hey, we're gonna do an X-ray to make sure it's where it should be, just to double check, and you would replace the gastric contents that you took out that you tested, or you would discard them based on your hospital's policies. And then you would fasten this tube with another piece of tape or a clip to their gown so that it doesn't move. And you would clamp the tube with a connector, which would be in the kit that you would have. Obviously, I don't have one. And then you would make sure that you keep their bed at a 30-degree angle or above that. So that would be semi-Fowler's or above. And that's the insertion.